ailment that affects millions of Americans, chronic pelvic pain syndrome.
The main symptom of frequent desire to urinate, which can also be painful. Eyewitness News reporter Gil McClanahan talks with a woman and a doctor about the condition in this week's Healthy for Life.
For people who suffer from chronic pelvic pain syndrome, a simple trip to the mall can be complicated.
Going places, you know, I have to map out where the restroom's going to be. Always have toilet paper or tissue or something with me just in case there's stops on the side of the road that I've had to make.
Kelly Gadd of Huntington has been dealing with chronic pelvic pain syndrome for 16 years. She saw 5 doctors who tried to diagnose her symptoms.
So it was kind of sounded like, you know, this is all we can do. There's nothing else. I'm sorry. And that's just kind of how it was.
It's more of an inconvenience.
Dr. Stephen Woolums, a urologist with Marshall Health, says chronic pelvic pain syndrome is not life-threatening, but it affects the patient's daily living. Treatment involves a closer look at lifestyles.
Are there certain behaviors that we can change that is actually causing it? Are they eating certain foods or drinking certain drinks that are causing the condition?
Bladder installations. And that has lidocaine, heparin, and sodium, and that literally goes into my bladder and coats that.
Gadd started doing that 3 times a week to help with her frequent and painful urination, and now she says she does that treatment once every other week if necessary, allowing her to go out more with her family.
My husband's not frustrated because he has to stop every 10 or 20 or 30 minutes, depending on what I had to eat or drink.
Although not cured, Gadd says Dr. Woolums has given her the reassurance that she can live a normal life with her condition.
I think a lot of women specifically suffer in silence.
With this week's Healthy for Life, I'm Gil McClanahan.